CBS 46 News presents Public Affairs on Peach.
Good morning and welcome to Public Affairs on Peach. I'm Karen Greer. October marks National Breast Cancer Month, a recognition that was started back in 1985 by the American Cancer Society. Well, since then, organizations from Susan G. Komen to the Breast Cancer Survivors Network have joined in the fight to find a cure. There's been significant strides, but the journey still continues. And joining me now to discuss what we've noticed and what we've been finding in these last couple of years, Dr. Erin Bowman, a breast surgical oncologist with Atlanta Breast Care, and survivor Mary Jacob Harris. Thank you so much, both of you guys, for joining us. So very important to talk about genetic testing, how important diet is, and a host of other things. We're going to begin with what strides you've actually seen, Dr. Bowman, in cancer treatments.
Many things have happened in cancer treatment. I mean, from years ago, many years ago, to when you had a diagnosis of breast cancer, no matter the size, the whole breast got removed, including the muscle. Today, we are able to offer patients the ability to choose between whether they save the breast and do what's called a lumpectomy, just taking out the cancer, or removing the breast, but still sparing the muscle. And not only just surgically, but there have been many strides medically with different medications where now we're individualizing treatments for specific breast cancers based on the biology of the tumor. It's just the research continues. We're finding out new things every day, and we continue to make strides in the treatments of breast cancer.
I want to say, Dr. Bowman, born and raised an Atlanta product, went to Spelman, actually.
I went to Spelman, yes.
And came back, went away, came back, and went to Morehouse School of Medicine.
I did, yes. So I'm actually born and raised in Philadelphia.
Gotcha.
But I came to Spelman, and Atlanta is my home.
Second home.
So second home, yes.
And how young and how old are the patients you're seeing? What's that range right now?
So my youngest patient that had a breast cancer diagnosis was 22. Wow. My oldest patient is 91.
Wow. And any surprises, any differences in how you would treat both of them?
Absolutely. So unfortunately, a lot of the diagnoses, as far as for younger women, are breast cancers that can be a little bit more aggressive. We're seeing that a lot more, as opposed to the typical ones that we've studied and know about that usually happen in women who've gone through menopause. So the treatment, when you look at both, regardless of age, is very different. But the important thing to also know is that breast cancer does not discriminate. So
Absolutely.
with that age range, it can affect anyone.
Mary Jacob, you talked to me about yours. You were actually preparing to start your family.
Yes, my husband and I were looking forward to hopefully starting the journey of having children of our own. And I went to see my OB, and she found a lump and said, let's get this checked out. So went to the Doris Shaheen Center and went through an ultrasound, a mammogram, biopsy, and Dr. Carrie Lawson called me with my diagnosis on October 3rd. She had set everything up for me to immediately meet with Dr. Bowman, paved the road for me, and I started treatment more or less immediately.
Mary Jacob, I'm going to stop you for a minute because what was that call like? Do you remember it even today?
I do. I was in my classroom and my students were coming in from recess, and I picked up the phone and I heard Dr. Lawson on the other end, and it's the one time you don't really want to have to speak to the doctor. And I said, I'm going to have to call you back because my kids were walking in the room, and I knew if it had been good news, it probably would have been a nurse. And so I called her back after the school day. I was in my classroom. She gave me the information. There was relief in knowing that I didn't have any phone calls to make. I had an appointment set. It was a Monday. I had an appointment set for Friday. And not only had she made an appointment with Dr. Bowman, she had called fertility specialists in the area because she knew that my husband and I were looking into having children, and just made it as easy as it could be. So,
how aggressive? What type of breast cancer?
So I was HER2 positive, and luckily it's one of the advances that we have made medically in cancer. I had no hormonal involvement, and so literally a month later I started treatment.
And what was your treatment choice?
So Dr. Bowman put my port in, and on November 10th, and on the 11th, I started with 6 rounds of chemo, including 2 medicines, Herceptin and Perjeta, which are not chemotherapies. They're more of a biotherapy. And 6 really brutal rounds of chemo. I ended up not completing my school year, and after the first 3 rounds of chemo, stayed home for the remainder of the year and allowed myself to heal. And I'm currently still doing Herceptin and have, after today, only 1 more round.
Wonderful. Congratulations.
Yes.
That's
Thank
been
you.
how long then since the journey began?
It will be a full calendar year.
Wow. Well, you
So,
look fabulous.
thank you.
And
Thank
just
you.
looking at patients like Mary Jacob has got to make you feel good about what you're accomplishing as well.
Absolutely.
In advancements.
It does. It really does. Especially when, and not to say that treating a younger patient, you know, affects me more than treating an older patient, but hearing her story, you know, she was wanting to start a family and newly married, and just, you know, that hits home. I understand it completely. So when we can have these treatments for these aggressive cancers that target specific factors or characteristics of the cancer to allow them to have a chance at a cure, it just touches me.
It absolutely does. Mary Jacob, you're how old now?
34.
Wow. And any family history?
No family history. So, caught totally off guard.
Right, right.
But so fortunate. I mean, go to the doctor. I didn't feel the lump. Still, after Dr. Lawson found the lump, I didn't feel it. So that's
You said
why we go.
you did monthly breast self-exams.
Yes, and I just would have totally missed it.
And that's how common is that?
Very common. It is common. I mean, I tell patients the most important thing, or women, the most important thing to do when you're doing your self-breast exam is not to try to find something, but to be comfortable with how your breast feels, because you're with your breast every day. But if something feels different, there's a question about it, to come in and get checked out. But it's very common that patients will not feel something, but something is felt by a physician.
All right.
Or
Okay. Thank you so much, Dr. Bowman. Mary Jacob, thank you for your time. We're going to take a break, but we are just getting started. Genetic testing for breast cancer is becoming one of the best ways to identify the risk in women and in men, but it's not for everybody. Coming up, we're going to talk about the pros and cons of cutting-edge technology.